So from the point where I got into medical school, every day was amazing and it was a gift. But halfway through medical school, I was involved in a motor vehicle accident, quite a catastrophic one, and I had a spinal cord injury as a result. A cervical spinal cord injury that caused paralysis from the chest down and my fingers as well. And obviously it changed a lot of things for me in an instant. I was in hospital for about 7 months and a fair bit more rehab after that. And this time really gave me a perspective on what it's like to be a patient, feeling disempowered and losing control of my choices and life. And I think that was really important in shaping my interactions with my patients today. After about 5 years, I went back to medical school. In Australia, it's not something that really been done before. Nonetheless, with a lot of help and a lot of work, we made medical school a success. Getting an internship and a job became a challenge after that. But again, after a bit of fighting and a bit of advocacy and a bit of support from the community and my friends, I got a job. Today, I've been spending most of my time in our emergency department, which has been really, really supportive. I've loved every single minute of the job. About 3 years ago, the organisation called the Medical Deans of Australia and New Zealand came together and they released a policy document. And this was called the Inherent Requirements document. And that specified a lot of things that they felt medical students need to have. For example, they talked about the need to have sensory function, the need to have full motor function, the need to pick up social cues, the need to have no interruptions in consciousness. And they allowed medical schools to deny entry for students with certain qualities, or exclude students that already have these qualities and are already studying medicine. And that was a really interesting thing for me to see, because that was just a short period after I came back to medical school with a spinal cord injury. But the area is actually really evolving in Australia, I think. In the United States, there have been some really concerted efforts and campaigns of late to try and make medicine a more inclusive profession, and that's really good to see. But I think some parts of the world are still lagging behind. When I first heard about the Inherent Requirements document, actually it really struck deep into my heart, because just to have someone think about setting me aside because of my physical attributes and to exclude me from pursuing what I really love, my passion. That was a really deeply personal thing, and I wasn't so much as offended as hurt. So I found that to be a really, really hurtful thing more than anything. You know, from one perspective, you can argue the need to have some standards or guidelines for these things, but what's really important to remember, I think, is that every single person is different. So every person, whether they have a disability or not, whether they have an illness or not, whether they have a chronic disease or not, whether they're whatever gender they are, I think every person's really unique. So to try and fit people into a box and to say, you know, if you have this, then you can't study medicine, or if you have that, you can't do this, I think that's a really rigid and not a sensible approach. After I digested that emotional aspect of it, I just realized that's not really acceptable, and we need to create opportunities for people rather than create barriers.